by Webster County, and of those 85, 77 went on for further treatment. What we have found is that people who come in for detoxification services and complete that program successfully are more able to then go on to the next level of care and be successful. It's very difficult to detox off of substances. If you haven't known anyone that has had a major issue with substances, you don't know the medical aspects of actually detoxing. It can be a very dangerous situation where people can have seizures, heart attacks, all sorts of different things. So they have to be monitored very carefully when they're in the detoxification program. 2012 to 13, we had 84 people from Webster County present for services. 49 of those were paid for by Webster County, and 63 of those transferred to the next level of care. And then this year to date, starting from July 1st, we've had 50 people present from Webster County. 30 of those were paid for by the county, and 43 of those successfully transferred. So you can see that it is a very popular program. This year, we are going to have record numbers in our detox program. On the news this morning, I don't know if any of you guys listened to the radio as you're coming in, but they were talking about in Iowa that last year we had a 5% increase in liquor sales, meaning that Iowans are drinking more than they ever have. I'm not sure necessarily what that's all about, but we do know that people are drinking at a younger age. There's a lot more of the binge drinking, and there's a popularity with different types of drinks to get more people involved. Women are more involved with drinking now. Teenagers are more involved. So it's a very important program, and we definitely have worked to save people's lives.
When you mentioned the number of people that have been served and then the number of people that are being paid for by Webster County, your rate is per day.
Yes.
You have, I guess I'm more interested in the number of days. Essentially, what a rate increase does for us in the middle of a budget year is if we accept the rate increase, we have a big problem with our budget.
Okay.
How many days are we talking about for, and say 2012, how many days do we pay for? Have you any idea on that?
The total number of days, it would depend on I did not run that. It would depend on the if they came in and the person was using alcohol or if the person was using opiates. Our opiate protocol is a longer protocol, up to 6 days.
Okay. Ken, do you have any idea what our expenditures are on a yearly basis?
Well, I didn't do the last year's. I know that as of this point, we have spent approximately for hospitalizations, we're right on target, 1/3 of our budget that was set aside for hospitalization detox, which would include all hospitals, not just CFR, but we're right on target for our expenditures for where our budget was, where we spent approximately 1/3 in the first 4 months. That's through October 31st from July 1. So in that respect, we're right on target. And just to answer the question in terms of numbers of days, typically if a person goes in voluntarily, we pay for the first 3 or the first 6, depending upon the type of detox that they're doing. So it would either be 3 or 6. Most folks, by and large, it's alcohol detox. If they're under committal, it's from the point of the intake to the point of the hearing that we generally would pay for. And then after that, Department of Public Health funds are usually accessed for anything beyond that if the person does go into other treatment.
Have you done any projections on what this rate increase would do?
Well, basically, if we're looking at 50 people in the first 4 months, and we extrapolate that out, we're talking quite a few more. And part of the reason more people have been paid for in this first 4 months of the year is because previously, if a person had legal settlement in another county, we would not pay for that person. We would ask the other county, even if they had a residence here in Webster County. If they have, now if anyone resides here in Webster County, even if they previously would have had a legal settlement elsewhere, it's all based on settlement now, so we pay for anybody residing here in Webster County. And so that's part of the change for the increased numbers that we're seeing. So if we take 50 times 4, you're looking at 100. You're looking at 200 people for each quarter. Or no, excuse me, it wouldn't be 50 it'd be 150 because that's for 4 months.
And you've actually paid for 30, and that's to date.
Okay, to date, and
Yes.
so there are still some outstanding we have not paid for, I would assume.
Correct.
I
Correct.
think-
So this is what I ran yesterday, and part of the issue I think with Webster County is that they have never paid the full rate of $299. The previous director had done discounts for counties, and I think your discount was at $215. So it does feel like an even larger jump, because it is a larger jump. There's other counties that were paying more than that for the services. So our goal as an agency was to have everyone pay the same rate, all the counties pay the same rate, and to have it be a rate that we actually can break even.
And the rate you're asking for is how much again?
$421.
$421. And when we're not using you currently, we use Allen, is that correct, for with transportation expenses?
It depends upon where there's a bed available. Yeah, maybe Allen, could be Mercy in Mason City.
Do you know off the top of your head what their daily rates are?
Those hospitals range, those are contracts arranged with their local counties. Generally they're going to range anywhere from $600 to $1,000. If they go to Spencer, it's $1,000 a day. If they go to Mary Greeley or Allen or whatever, they generally run around $700 to $800 a day.
I know one of the things that we've been doing here in Webster County is working with Unity Point Hospital, because they also have quite a few clients that they have detox through their program, and they are no longer wanting to provide that service, so we're doing some detox diversion. So we've been going out to the hospital, doing evaluations actually at the hospital, and then diverting them, because they were telling me they were over $1,000 a day, and they just were not, as a hospital, able to continue to provide that service.
So how did you come up with the 421?
What's that?
How did you come up with the 421 number?
The 421, what we did is we looked at the cost of the service. Our service is run and staffed by nurses 24/7, so you have the cost of your nursing staff, and then you have the cost of just the general food, shelter, those types of things, and then we divided it by the number of bed days that we were hoping to be able to provide this year. We based it on what we've done in the past.
Ken, have you done any kind of projection on how much additional burden this would place onto your budget?
I haven't, no. I guess I haven't, no.
And if they go to a hospital, are they covered by anything else besides the county?
If they go to a hospital, if they've got insurance,
Besides private
yeah,
insurance?
Trinity, we don't pay Trinity,
Right.
so unless it's a committal, as far as the transportation, but we don't pay their cost for their hospital.
But if they go to Allen or Mercy, they're covered by other things besides the county. The county doesn't pay that $1,000 rate.
If they're committed, we do pay them.
I understand.
Right, but for voluntary, no.
Detox services, right?
I'd have to check
Okay.
for sure. I'm not sure on that.
I didn't know if that's a Medicare and Medicaid type thing, or a Hawkeye, or how that works.
There certainly are, if you look at the numbers, so up to date, we've had 50 people from Webster County that have gone through. 20 of those were either self-pay, where they paid the full rate, they either had Title 18 or health insurance. Things also may change starting in January, because there's going to be more people that are insured. We are not, I can't project for you how many of those clients that come in our door will have insurance, but what I can tell you is that when we ran the numbers at CFR, 70% of the clients that are on our current Iowa Department of Public Health contract will be eligible for traditional Medicaid. And Medicaid does pay for the service. So I do know that the numbers are going to change throughout the year. I can't tell you for sure how many of those people are going to come in or any of those types of things. But at this point,